Goodman is an assistant professor at the Oregon Health and Science University at OHSU and the OHSU PSU School of Public Health. She's a health policy researcher who studies how work and work-related policies affect maternal and infant health. And she earned her PhD in health policy and her MPH in maternal health and maternal and child health from UC Berkeley. And she also holds a Bachelor of Science degree in psychology from McGill University. So Julia, it looks like you are up and running, and I'm going to turn it over to you.
Great, thank you. Can you hear me okay?
Sure can, yep.
All right. Great. Well, thank you for sticking around to the last presentation of the day. It's been such an exciting day of presentations. I've really enjoyed all of them so far and learned so much. So thanks for inviting me. I feel honored to be part of this really great group of speakers. So I'm going to build on a lot of what's been said throughout the day and bring our focus in particular to a period in the life course when work has a particularly striking and critical role. So just to give you a brief overview of what I'll talk about today, I'm going to start by providing an overview of maternal and child health indicators in the US to describe how we're doing relative to other high-income countries. Then I'll discuss what we know about the ways in which work influences these outcomes. And then I'll spend the second part of the presentation talking about some key findings from a study that I recently conducted with collaborators in San Francisco to try to understand the impact of a policy that was passed there a few years ago that is the country's first fully paid parental leave policy. And I'll close with a couple of takeaways. So it's no secret that the US health rankings have fallen below our peer countries across a range of domains. For example, while female life expectancy in the US, which is shown here in red, has slowly increased over the last few decades, we haven't kept up with the gains that have been made in our peer countries. So we've moved from being about average among high-income countries in terms of life expectancy to now having the lowest life expectancy among high-income countries. Similarly, we've seen infant mortality decline dramatically over time across the globe, but not at the same pace in the US as in our peer countries. So infant mortality rates are now quite a bit below ours in other high-income countries. One of the major drivers of infant mortality is the rate of preterm birth, or births that occur before 37 completed weeks of pregnancy. So as this map illustrates, the preterm birth rate in the US is well above other high-income countries. And in fact, it puts us in the company of countries that have far fewer resources than we do. The burden of preterm birth, unfortunately, falls disproportionately on communities of color. So we see the highest rates of preterm birth among non-Hispanic, Black, and American Indian and Alaska Native women relative to white women. Thankfully, less common, but even more devastating area in which the US falls short is in maternal mortality. So maternal mortality refers to the death of a woman while pregnant or within 42 days after the termination of the pregnancy, whatever the cause of the termination. Or to a condition that was aggravated by pregnancy. So in the US, about 28 women die for every 100,000 live births in a given year. And you can see in this ranking relative to other high-income countries that we fall way down at the bottom. And again, the burden of maternal mortality falls greatest on communities of color, and in particular, Black women. Black women in the US are 3 times more likely to die from pregnancy-related causes than white women. And this is a statistic that, honestly should be a national shame, and it really represents a failure of many different systems and institutions. We know that part of this is a result of both interpersonal and institutional racism. So one potential contributor to these poor health outcomes that has received less attention is the role of work. As Nancy Marshall summarized in a recent National Academies workshop on women's health in the US, there are 2 competing views on the role of employment in women's health. On the one hand, women's employment conflicts with their family responsibilities and creates role overload, which could negatively affect their health and well-being. On the other hand, women's employment provides them with an additional arena in which to develop competencies, self-esteem, and social connections, and the combination of roles would enhance women's health. She goes on to say that these factors and their net impact on women's health varies throughout the life course. And there's more evidence that work can have an adverse impact on mothers of young children, and especially in the perinatal period, or the period right around childbirth. So what should we take away from this? Should we say that women should stay at home and not work during pregnancy? Does working at all lead to worse birth outcomes? Well, evidence suggests that this is not true. A majority of women work during pregnancy. Among women who were giving birth for the first time, about 2/3 of women were employed during pregnancy. And among those, about 86% were employed full-time. Female labor force participation among women of reproductive age in the US is actually quite a bit lower than the average among peer countries. So it doesn't seem that working in and of itself is causing these inequities that we're seeing. Studies that have examined whether employment during pregnancy, that is just whether a woman was employed or not during pregnancy, studies that are looking at that relationship on that impact on health have for the most part found no relationship, or even in some cases a positive relationship, perhaps due to a healthy worker effect. But as this group certainly knows, all work is not the same. More likely, what we're seeing is more about work conditions or how we work than whether women are employed during pregnancy. So for starters, many women in the US work very close to childbirth, both during pregnancy and then in the postpartum period or after the child is born. In the US, more than 80% of all women who work during pregnancy worked until the very last month of pregnancy. And this is even higher among those who are working full-time. And most women also return to work relatively soon after giving birth. A majority in the US are back at work within 3 to 4 months of giving birth. Compare this to our peer countries that have much more generous leave policies, where the average duration of maternity leave is much longer. So, as I just foreshadowed, why is this? Well, in the US, we generally have a much smaller safety net than relative to other countries that might otherwise allow pregnant workers to stop working without losing their source of income. So the US, as this map shows, is one of the only countries in the world that doesn't provide any form of paid leave for new mothers. And by the way, it's also just one of 2 high-income countries in the world that doesn't have any paid leave for new fathers either. So perhaps it's not surprising then that most of the literature that links employment to maternal and child health outcomes is focused on employment conditions. Women in the US spend a lot more time at work during pregnancy than women in other high-income countries, and potentially exposed to hazardous conditions, stressful conditions during pregnancy, again, relative to our peers. During pregnancy, work schedule and exposure to physically demanding work have been linked to a range of adverse birth outcomes, including most prominently preterm birth and miscarriage. And the lack of paid parental leave, which pushes women back to work after childbirth much sooner than a lot would like to, has also been linked to adverse impacts on women and their families. So the lack of access to paid leave has been linked to decreased breastfeeding rates, lower immunization rates for babies, higher infant mortality, increased postpartum depression, and even things going much later into the life course, like increased depressive symptoms in later life. So you may be asking, or you may not, after some of the presentations that we've heard today, don't we have laws that protect pregnant workers? Why are we seeing so many women in the US exposed to hazardous and stressful conditions during pregnancy? Well, we don't necessarily have laws that really protect pregnant women. There are a range of federal, state, and local laws that work to prevent pregnancy discrimination, including the Americans with Disabilities Act, the Pregnancy Discrimination Act and the Family and Medical Leave Act, which provides job-protected but unpaid leave to some workers. Here in Oregon, as far as I can tell, we don't have any additional state or local protections for pregnant employees, but we did just pass a paid family and medical leave bill that provides additional job protection and will go into effect in the next couple of years. But within these laws that do exist, there are a lot of holes, and they are generally not well enforced. I think this links really well with the previous presentation and thinking about the most vulnerable workers who are often explicitly excluded from these policies, and certainly face a lot additional stigma and additional pressure not to report violations because their work might be at risk. So this, I'm showing you the headline from a powerful New York Times investigation from 2018 that reported many women working in strenuous jobs who had lost pregnancies after their employers denied their requests for light duty, even ignoring doctors' notes saying that they needed those. And so, again, going back to the inequities that we see in birth outcomes, who is most impacted by these sorts of workplace violations? Which kinds of workers are most likely to be exposed to or to be subject to employers who are not heeding the recommendations from providers saying that women need to take light duty or have other kinds of modifications in their schedules? Okay. So when we're thinking about access to paid leave, women, workers of color, and low-wage workers are disproportionately left out of these laws, as well as some of the other policies that I just mentioned. So, for example, the Family and Medical Leave Act covers workers at firms that have at least 50 employees within a 75-mile radius and who meet minimum job tenure and hours requirements. This ends up excluding about half of all workers, disproportionately women, low-wage workers, and workers of color. So here, what I'm showing you is access to paid and unpaid leave by income, by occupational wage level. And about a quarter of the highest wage workers have access to paid family leave through their jobs, which is not great. But when you look at the lowest wage workers, only about 10% have access to paid leave through their jobs. So now that I've hopefully convinced you that work is an important social determinant of maternal and child health, and that there's potentially a real connection between some of the policies in the US and some of these really adverse birth outcomes that we have relative to other high-income countries, I want to turn our attention to one recent effort to do something about this, and what our study reveals about some of the challenges in implementing this type of policy. So in April of 2016, the San Francisco Board of Supervisors unanimously passed the Paid Parental Leave for Bonding with New Child Ordinance, also called the Paid Parental Leave Ordinance, or PPLO. So at the time the PPLO was enacted, California already had a statewide paid family leave program in effect. California was the first state in the US to pass a paid leave policy more than a decade ago. So the ordinance in San Francisco built on the California paid family leave program, which provided 55% wage replacement for up to 6 weeks of leave to bond with a new child. The California program, by the way, has since increased the wage replacement rate to 60 to 70% of wages, depending on income, starting in 2018. But at the time that the PPLO went into effect, it was building on this 55% wage replacement, and it mandated that covered employers provide supplementary compensation to employees in San Francisco, such that an employee earns 100% of their weekly salary, up to a cap, during the 6 weeks of leave for bonding. So the policy began implementation on January 1st of 2017 with the largest employers, and then it was phased in over the next year to include all private sector employers with at least 20 employees. So you can see here how this complex set of policies fits together. I didn't even mention previously the state disability insurance program, which covers the first 6 to 8 weeks of leave for parents who are recovering from childbirth. But I'm showing you this partly to sort of foreshadow some of the challenges that we saw with the policy. This is really complex. There are a bunch of different policies at the local and state level that are all trying to work together. So our goal in evaluating this new policy in San Francisco was to understand the impact of the PPLO on leave taking, particularly among lower income workers, and to determine whether this type of policy was feasible and acceptable to employers. That is, is this something that we could scale up, that we could feasibly expand to other places? So to do this, we used 4 distinct approaches to understand the impact. And I'll go into each in more detail, but just as a brief sort of overview, we first conducted stakeholder interviews, which told us that early implementation was generally pretty smooth. We then conducted an interview with employers across the Bay Area, which told us that the policy was generally acceptable, and I'll give more detail in a moment. We then looked at administrative data from the California Employment Development Department. And this is where we saw that there was relatively little impact overall on leave-taking behavior in response to the policy. And then to sort of dig into understanding why that might be, what is going on, we did a pre-post survey of mothers who had given birth in the Bay Area in the year before and after the paid parental leave ordinance went into effect. So first, I'll talk a little bit about what we learned from the early stakeholder interviews. Overall, we did these interviews in the middle of 2017 when the policy had been in effect for less than a year. And overall, the response was that it was going pretty well. It seemed like implementation was pretty smooth. We talked to stakeholders from labor advocacy groups and government groups, and they all expressed surprise at the lack of opposition from the business community. This is something that traditionally the business community is very opposed to and raises a lot of concerns. And at least in San Francisco, the community was mostly focused on sort of the challenges of how they could implement it and trying to understand what their responsibilities were, as opposed to really being full on opposed to it. And they really credit this to a lot of outreach and education work that was done both from some of those labor advocacy groups and the employment offices within San Francisco to really reach out to employers, bring them into the conversation, and help them help understand what their concerns were. So just a couple of quotes from our interviews. One from the labor advocacy group said, "The lack of opposition was kind of amazing. There was never a 'we can't do this,' only these are the things to change." And I think that sort of summarizes the response, that they were surprised that the business community really came at this with an open mind, saying, okay, how are we going to figure this out? And some of them credited it to things like San Francisco is a place where there are a lot of employment-related policies that have gone into effect in the last several years. And the business community sort of thought, well, like this is just happening, and so we need to figure out what to do and how to work with this. So, I think that was something that was pretty positive. We did, though, identify some challenges, or the stakeholders that we talked to identified some challenges in implementation of the policy. So they flagged that employers said benefits calculations were really complicated because this is a policy at the local level trying to interact with state policies. There was complication in trying to understand how much they were responsible for versus what their employees were getting from the state program. This gets really complicated when you're talking about different kinds of workers, like workers who have tips versus just salary and wage income, employees who have multiple employers. Those were both really complicated situations that employers didn't know what to do with. And then we heard about a lot of delays in receiving benefits, that it took a while, especially to get benefits from the state part of this. The second part of our study then was a more detailed and expansive set of survey with Bay Area employers. So we talked to almost 300 employers across the Bay Area to try to understand their response to the policy and their support for the policy. So overall, more than 75% of employers were familiar with the paid parental leave ordinance, and this was a little bit higher in larger employers versus smaller ones. we saw that, at least according to the employer's own reporting, there was a significant increase in the proportion of employers in San Francisco who were offering paid parental leave relative to those in the surrounding Bay Area counties that weren't covered by the ordinance. We see, as you can see in the blue bars here, in the period that we looked at, the surrounding counties increased their offering of paid parental leave, but there was a much larger increase, a statistically significant increase of about 20 percentage points in San Francisco, even taking into account the changes in the surrounding counties. In terms of the impact of the ordinance and in offering paid leave on businesses, we really didn't see any changes in benefits cuts or price increases that the businesses were reporting. And employers reported that the PPLO didn't hurt profits, but it did help morale and to some extent employee retention. And this is something I just want to flag. We heard this echoed in another study that Dr. Richardson alluded to earlier this morning that I recently conducted with Dr. Richardson and Dr. Debbie Hurtado, looking at a paid parental leave policy at Multnomah County. And we heard the same thing, that there was so much increase in loyalty to the organization, sort of people felt valued when their employer had implemented this kind of policy. And it was really striking how much it seemed to mean to employees to have this kind of benefit available. So as I think our stakeholder interviews sort of foreshadowed, we did see that firms reported compliance was difficult. A lot of employers told us that it was difficult to understand the legal requirements, to understand their responsibilities, and difficult to administratively comply with the ordinance. Support for the PPLO, despite all of those challenges, was pretty high. About 80% of employers that we talked to were somewhat or very supportive of the PPLO. We did ask about, so the PPLO is different from other policies because it has an employer mandate. The employer is required to cover the replacement wages for their employees that take leave, as opposed to sort of unemployment insurance or disability insurance type structure where it's funded through payroll tax. And so we asked employers about how much their support would change if it were funded through a payroll tax as opposed to through a mandate. And we did see that quite a few employers would be more supportive. And I think that's something to keep in mind in terms of bringing in even more support from the business community for this type of policy. What are the ways that we can design policies that are more equitably distributed and get more support from employers? So the third part, just briefly, third part of our study was looking at administrative data from the California Employment Development Department. And here we wanted to get a bigger picture look at what the impact of the policy was on leave-taking behavior, on the number of people who are taking leave and the duration of leave that people were taking. So because workers in San Francisco need to have filed a paid family leave claim with the state in order to be eligible for those benefits through their employer, when we look at the state paid family leave claims, this should reflect changes in response to the San Francisco policy. So that's why I'm able to use these state claims to look at changes in the San Francisco policy. So when we compare to the surrounding Bay Area counties and to the rest of the state, the number of men filing claims in San Francisco increased by about 13% in 2017 after the policy went into effect. So we see a significant increase among men in terms of just uptake of any leave, although it wasn't quite as big as we were expecting. And when we look at women across in the Bay Area compared to what we would expect from surrounding counties and from the rest of the state, we essentially see no impact on leave taking. And with women, we thought maybe we wouldn't see an increase in uptake because most women were taking, under the assumption that most of the women who are filing bonding claims were the birth parent, that most of them were taking some amount of leave and we would see more of a change in the duration. And we really didn't see a change there either. So why is this? Why did we not see a bigger impact of this policy on leave-taking behavior? To try to understand that, we looked to our survey that we had conducted of mothers in San Francisco and the surrounding counties in the year before the PPLO went into effect and then in the year after. And here we were really focused on their understanding of the PPLO and their knowledge of leave benefits. So one of the things that really stuck out to us were these huge differences in knowledge by income level. Lower income women were less likely to report that they understood the maternity leave benefits available to them, or that their employer was helpful in making sure they understood the benefits available to them. They were also far less likely to report that their employer was a main source of information about paid leave benefits, and they were most likely to report that they received no help. Another part of the story here seems to be about coverage and who the policy actually covers. So while most women and their partners, regardless of income level, were employed at the time of birth, among employed workers, lower income women and their partners were less likely to work in jobs that were covered by the PPLO. That is, they were less likely to work in jobs in the private sector that had at least 20 employees and to meet the minimum job tenure and hours requirement. So a related issue that we looked at in a recent issue brief is job protection. And one of the things in that sort of complex map of different policies, what I didn't highlight is that none of those policies that provide wage replacement provide job protection. Those are separate laws, so they're covered by the Family Medical Leave Act or the California Family Rights Act, the California version of FMLA. And so we looked separately at job protection to see how much that contributes to the story, because if people have access to wage replacement, but they could lose their job for taking it, they may be less likely to take advantage of those policies. So we looked at our same sample of mothers across the Bay Area and mothers reporting on their partners as well, where there was a partner involved. And we looked at who had job protection and who would gain job protection under various policy scenarios. So recently, California actually just passed the Senate Bill 1383, which expanded their job protection to employers with at least 5 employees. And that's down from the most recent amendment that was, or the most recent law that was passed in 2018, provided job protection for those with at least 20 employees. So we looked at sort of under these different scenarios, what does job protection look like? Who has access to job protection? And we see that for the most part, men and women have actually pretty similar levels of job protection under all of these scenarios. Although even with this most recent policy change, about 20 to 25% of employees would still not have access to job protection because they don't meet the minimum hours or job tenure requirements to be eligible. And we really see differences when we looked at this by race ethnicity. So the biggest differences were that non-Hispanic Black and Hispanic women were, under all scenarios, far less likely to have job protection. And even with the most recent policy with SB 1383, we get closer in those groups to having sort of parity in terms of job protection, but still almost 30% of non-Hispanic Black and Hispanic women and men would lack job protection, or still do lack job protection for parental leave. So from this overall project, we learned a lot. And one of the things that we really wanted to focus on is what is contributing to this low awareness and the confusion that we see around these laws, because it seems like that's part of the story about why we didn't see a bigger impact on leave taking. So the biggest issue is that small employers are exempt from the PPLO, and this excludes a lot of workers. Disproportionately, this excludes workers of color and low-income workers as well. The enrollment rules for these policies are really complicated, and in particular, the PPLO did not seamlessly integrate with the existing state paid family leave benefits, which it was designed to do. So this is something that I think as we expand policies, paid leave policies, and job protection policies at the local and state, and hopefully someday at the federal level, we really need to be aware of how these policies can work together, or how much they're adding confusion and complexity. Right now in California, there's a set of policies at the state level and now at the city level that are designed to support parents to take longer leave with more wage replacement. But these policies each require separate enrollment and have different eligibility criteria, and it makes them very difficult to navigate. Another issue is that employers themselves found this policy really confusing. Our employers that we interviewed reported difficulty understanding legal requirements, administratively complying, and understanding their responsibilities regarding wage replacement. Job protection is uneven. The requirements for job protection, as I mentioned, don't always align with the requirements for paid leave. And this patchwork of rules creates confusion among parents, especially those that are experiencing pressure from their employers to return. This disproportionately affects lower income parents and parents of color who are least likely to have job protection. And finally, employers were just not a reliable source of information for many workers. Only half of the Medicaid-covered women in our sample said that their employer was helpful in understanding their parental leave benefits. In the context of complex policies that vary by employer and employee, this leaves many parents without adequate knowledge to take advantage of these benefits. They really aren't getting information and don't understand what they're eligible for or how to go about taking advantage of those benefits. So what are some suggestions moving forward for how we could improve these types of policies? Our study suggests several recommendations for making these policies more effective. First, we should make paid parental leave universally available. So in addition to ensuring that most vulnerable workers would be covered, this also simplifies the messaging so that working parents will just know that paid leave is available and that their job is protected, so they'll take it when they need it. And I think we should go beyond this and say this should not be limited to only parental leave, that making paid leave for caregiving, for caring for one's own illness, should also be made universally available. Second, we should figure out how to unify enrollment through a single government portal based on one's place of residence. And we've been working with some advocacy groups in California and with a paid leave task force that the governor put together in California. They're exploring the idea of using something like navigators, something like patient navigators, to help both employers and employees navigate the range of work-related policies that are available there. And you know, right now, this is set up where if there are different benefits in different regions and they have different kinds of enrollment criteria, it's all on the employee to try to navigate that and figure out what they're eligible for and how to go about applying for it. And so we're starting conversations about what would it look like if we had a single hub for information, for enrollment, and we had navigators who could help people kind of walk through that to make sure that workers are actually getting the benefits that they're entitled to. Third, in cases where employers and employees both agree, and I think this is something that's a little bit tricky because you can imagine where you have to have protections in place to make sure that employers don't take advantage of this, but where there's agreement, we should try to make it possible for employers to file claims on behalf of their employees. And this gets to this issue that we heard about around the delays in getting payments from the state in particular. So if the employer can actually pay benefits directly to their employees and then get reimbursed from the state, rather than having the employee wait for benefits to come in through the state, and this may be weeks without getting any kind of payment, this can be a more streamlined process and prevent workers from going weeks without having pay during a really vulnerable period. And then finally, family leave should be fully funded from a central tax-financed fund. So as I mentioned before, the PPLO is unique in that it requires employers to determine what wages are paid by the state to the employees, and then to pay the remainder from their own funds to the employee. This process is complex and especially challenging for smaller employers that don't have full-time human resources staff, as many of them don't. It also raises fairness concerns for employers that are hiring a disproportionate share of new parents. So in the San Francisco survey, as I mentioned before, 43% of employers told us that they would be more supportive of the policy if leave was funded through a payroll tax rather than an employer mandate. And this kind of increased employer support and cooperation is really essential if we want to achieve the public health benefit of a simple and universal leave system. So just to wrap up, a couple of takeaways from, hopefully from the whole presentation. I think as this day has really illustrated, work is such a core social determinant of health, but has received relatively little attention in terms of the specific characteristics of work and the workplace that affect health and drive health inequities. And at least in the public health domain, I think it's still really underrepresented and undervalued. And so that's why this whole day has been so exciting to see all this energy and great work. The population health impacts of work as a social determinant of health span the life course, but in the US in particular, where we have, we lack basic workplace protections, these impacts are particularly critical in the time around childbirth, around pregnancy and childbirth. One important step toward addressing the poor performance of the US on these maternal and child health indicators relative to our peer countries could be to change the way that we approach work. We need to improve and expand workplace policies as a strategy to reduce inequities in maternal and child health. And finally, I think this audience certainly knows this, and we've heard a couple of people talk about the life course, the intergenerational transfer of stress, and a lot of what we're really learning from the perspective of things like the developmental origins of health and disease. But I think we really need to start pushing these policies as an investment in our future. Focusing on maternal and child health is good for a lot of reasons. Of course, we want to think about the impact of these policies on improving the health of women, of people who are experiencing pregnancy. And that's an important goal in and of itself. But beyond that, there's also important intergenerational effects that we know that, reducing exposure to toxic stress during pregnancy can have an impact on the next generation, on the long-term outcomes of offspring as well. So just thinking about this life course perspective and how it really policies that are targeting workers during this critical window can have such long-lasting and expansive positive impacts. So I just want to close with a couple of acknowledgements on the San Francisco evaluation. My main collaborators have been Will Dow at UC Berkeley and Holly Elser and Connor Williams, both at Berkeley. And then we worked a lot with different agencies in San Francisco at the Office of Labor Standards Enforcement and Legal Aid at Work, which were both great organizations doing this kind of work on the ground and trying to understand how to make this policy work. And then the San Francisco project was funded by the Robert Wood Johnson Foundation and through a Work Family Support Research Hub as well. So thank you. I look forward to your questions. If you're interested in more on our San Francisco evaluation, you can look at this website here. And then I just listed one organization that's doing a lot of great work, especially with very useful resources for employers about how to support pregnant workers. Thank you.
Great. Thank you, Julia. Wow, it really makes me think about health literacy and then about benefit literacy, really. And I don't know if there's much work done around benefit literacy specifically, but I think that your work, obviously has lots of implications, but for me, I'm really, paying attention to just how confusing it all is, and not just for employees, but also for employers. And so it's one thing making, right. Yes. I think your point about making everything universal would be one way of reducing that confusion. But I think also people need more education and not just people, individual workers, but also employers. So it was very powerful. I will turn it over to Nicole. I don't know if there are questions, Nicole, or what
I have a couple.
Okay, you have a couple.
Dr. Goodman, I really like this presentation because I think you're kind of getting into some of the practical and the operational aspects of leave. You just touched on them briefly, but they were important and powerful to me. particularly this idea, you said unifying enrollment through a single government portal by place of residence with navigators. I mean, that seems like, just such a direct way to deal with this and so potentially user-friendly. I get excited, and I know we're talking about a government portal here, and there's a lot of limitations, and many of them are for good reasons. But what a neat opportunity to also inject a little bit of supportive supervisor behaviors and strategies into a portal like that to sort of increase that literacy, not just around the benefit itself, but how to make the benefit work. It seems like that could be a really valuable thing. And I did have a question. It's so exciting, and it's neat to be able to. California really does a lot of experiments, and we can all learn so much from that. What is your assessment of sort of the appetite nationally around these efforts? Is it different from region to region? Can you just talk about that for a moment?
Yeah. I think it's a good question, and sometimes it's challenging because a lot of the research is done in California because they were the first in the paid leave policy, paid family medical leave, and also have passed other kinds of worker protections. And so they're a great place to study. But also, like when I've testified here in Oregon and talked about some of our work in San Francisco, people don't want to hear about what San Francisco is doing. Everybody says, well, that's San Francisco. They're different. That's very different from Oregon's context, which is, it's true and not true, right? There's a lot of things I think we can learn from San Francisco, but it is a different place. So I think that's reflected in some of the response from the employers in San Francisco that were like, well, like this is San Francisco. We just know that's the cost of doing business here is we have these sorts of policies. So I think that it's not necessarily regional. It's actually been the first states that passed these kinds of policies were all states that already had state disability insurance programs, and they could expand them relatively easily. Like logistically, they could be expanded to say, well, in addition to being able to get paid leave for your own disability, you can now use that for bonding purposes. And so they didn't require a new whole, setup. They didn't have to start collecting taxes that they weren't doing before. So that's why the first states it was California, New York, Rhode Island, New Jersey. These are states that had those kinds of policies in place. Washington State was the first that didn't have that kind of policy, that kind of structure in place to pass a paid leave policy. And it was a real challenge. I think it took a while for people to say, well, how are we going to get this over the hump and figure out how to make it work? And since then, there have now been several other states, including Oregon, just last year. We passed a paid family medical leave policy. And, it's a big lift. We have to figure out now how to start collecting taxes and how it's going to be run. But that's, I think there was a Family Forward as an organization here in Oregon that's done a ton of work in this area and really spearheaded that effort. I think there was enough of an appetite and enough of a push for it here that people said, well, we can figure out the logistics of making this work. Nationally, I think, I'm a lot more hopeful now than I was a week ago. This is something that 4 years ago, people thought was probably going to come soon at the national level. At the federal level, there's been the Family Act, would provide paid family leave, and has been, introduced many, many times over the last several years, and has, essentially been put on hold for the last 4 years. But there's a lot of hope that this will happen in the next administration. So it's, I think it still kind of varies. There are some, like in the South, there aren't any paid leave policies yet. There are fewer. Colorado actually just passed one by ballot initiative in last week, which was the first. So that's really exciting. It's moving forward. It is moving forward, but it's kind of piecemeal.
Thank you. That's insightful. We have two more questions. Do we have time? Great. So from Dr. Lloyd, would you anticipate that the relative acceptance of the San Francisco employers represents decades-long education and messaging that might not be as easily translated to other parts of the country? We touched on that a bit. Is there anything specific to the way that San Francisco was sort of set, how they set the stage for this in previous years?
That's a good question. I mean, I think in that San Francisco employers sort of know that because there are a lot of relevant policies that have been passed, they're sort of attuned to that. And actually we're getting ready to field a follow-up survey for our employers that starts to look at some of the impacts of COVID on these sorts of policies and their workforce. And to prepare for that, we did some qualitative interviews earlier this summer to get a sense of where they were and what the questions should be. And one thing that came up was that a lot of the employers have, even smaller employers, contract with firms that help tell them about benefits. So they either get it from a professional association, the Chamber of Commerce, or they have a subscription service essentially that sends them a newsletter with all of the things that they need to be aware of. And I think in San Francisco, because there are so many employment policies that they need to track, that's maybe more common than in other places, that that's considered a worthwhile investment where it might not be in a state that doesn't have as many changes happening so frequently. So I think that could be part of it. And I think relatedly, I think the city of San Francisco, the San Francisco Office of Labor Standards Enforcement, has been really proactive in working with the business community. The San Francisco policy, it was passed in April of 2016 and went into effect January of the next year. So it wasn't like they had a long time to prepare for it, but in those months, they did a lot of work, as well as legal aid at work, especially on the reaching out to employees. But both together did a lot of work to reach out to employers to say, here's what, this just passed, it's going to effect in January. What do you need to know? What are some of the challenges you anticipate? And proactively went and talked to, restaurants, small businesses, larger businesses, tried to get a sense of what would be needed. And that's actually where as I mentioned, the policy was phased in. So it started with the largest employers and then eventually got down to the smaller employers. And that phase in was something that they added in response to feedback from employers who said, we just need a little bit more time to get prepared for this, the smaller employers in particular. So I think it's not that these aren't things that can be translated elsewhere, but they do have a history of sort of working together, the San Francisco offices and employers in San Francisco.
And they may not have the same kinds of technology issues at the state level that some other states may enjoy.
Well, they certainly do at the state level. We did hear that from whenever we came to what was the role of the state employment development department? Did they help you? And everyone was like, no, that was a challenge. So I think the city of San Francisco maybe has more resources in their offices than at the state.
Brilliant. And one more, just to kind of piggyback on that. I wanted to have an acknowledgement from Kate Wood that this study occurred during a very healthy economy, and we're wondering about the uptake of these policies during a down economy. And I think that relates to the next question, so I'll read that right away. The slide that showed almost half of San Francisco employers who were providing paid leave before it was required. Is that part of the acceptance? It was already being done by a lot of employers. I mean, I know we've been touching on this, but I think it helps to reinforce, sort of the antecedents of how this all happens. So. Mm-hmm.
Yeah, I think it's a really good question. And that's something that's part of why we're trying to do a follow-up survey now to get a sense of during COVID and the recession, what are these policies going to look like? I mean, on the one hand, when the federal policy that supported a little bit more paid leave for caregiving and paid sick leave, with efforts around COVID, we thought, well, maybe this will lead to longer term change where states, cities, employers at different levels, people will say, okay, well, here's this benefit. It hasn't been that difficult. It's been really important for my employees. So maybe we'll keep it around. And it seems like that's probably not what's happening. And unfortunately, I think at the beginning of the pandemic, I was hopeful that one takeaway would be we recognize the importance of these sorts of policies to support, working families and workers so that we don't have people coming to work sick. And I think there has been increased recognition of that, but I'm not sure that's sticking around at the policy level. we'll see. I mean, the states like Oregon is still moving forward with implementation of our paid family leave program, but I've heard that it may be a little bit slower than expected because of everything that's happened in the last several months. I would expect that other states that maybe were closer to passing something like this, on the margin, people might be less likely to support it if they're worried about the cost. Although I think in the fact that Colorado just passed something in the middle of all of this shows that you're sort of weighing, do we care more? Are we paying more attention to the need for this sort of policy because of COVID, or the challenge of this kind of policy because of COVID and the recession? And Colorado suggests that maybe people care more about or focusing more on the increased need as opposed to the increased challenges.
Wow.
My hopeful note.
All right.
Excited to keep track of this one. Dr.
Yes.
Goodman, thank you.
Yeah, thank you so much, Julia. Really